I'm thrilled that Dr. Shafeena Premji, a family physician and a menopause specialist, is taking the time to help us understand a little bit more about the links between menopause and cardiovascular health. So let me tell you about Dr. Premji. She is the founder and director of Milestones, which is the Milestone Menopause Center of Southern Alberta. So she works with patients in menopause every day. And she's a member of the Canadian Menopause Society Board and the Medical Advisory Board for the Menopause Foundation of Canada. So thank you so much, Dr. Premji, for agreeing to come and talk to us a little bit more, help us understand for World Menopause Day what menopause does to a woman's body. So that's the first question I'll ask. What is menopause exactly, and how does it impact our bodies?
Thank you, Dawn, for the welcome and the warm introduction. I live, breathe, and eat menopause all day long. And so I think it's really important that women understand the definition of menopause, but even more so, understand the history of how menopause even has come to be. So, when we look back even 100, 120 years ago, women were actually passing away. So their life expectancy was around the age of 50 or 51. So really, women saw menopause or didn't even see their menopause because they actually did not outlive that time frame. So really, it was a end of life event. However, now over the last 120 years, the now life expectancy is in the mid 80s. And so menopause is now more of a midlife event. And women are living for 30 plus years in menopause. And so it's an important time in a woman's life where she has hopefully the opportunity to reconsider some of her life choices, lifestyle choices, and to really make a priority for her to focus on her own self-care and health. Menopause is really a one-day event, and that day occurs when a woman has gone for 12 months consecutively
Hmm.
without a period. So we as women were actually born with a certain number of eggs in our ovaries, and the highest number of ovaries are found in our bodies when we are actually a fetus inside of our mother. And when we are born, we have about 500 million eggs. And by the time we hit menopause, through natural ovarian aging and attrition and loss of the function and quality of our eggs, that's when menopause hits. And in Canada, that average age is around 51, but it can range anywhere from 45 to 55. Now,
Wow.
women can go into menopause naturally and spontaneously, or it can happen through surgery, where a woman will have both her ovaries removed simultaneously, and that is considered surgical menopause. There are also some women who may have gone through cancer or radiation therapy that may have affected their ovarian function, and for which they are at risk of going into menopause early or prematurely.
What is the connection between menopause and heart health?
I love this question because I know that, most patients who come to my clinic when they are in that late perimenopause transition, or even once they are in menopause, and all of a sudden their cholesterol levels go up, or all of a sudden they develop hypertension or high blood pressure. And they tell me, I haven't done anything differently. I live the same lifestyle. I make the same dietary choices. I continue to exercise. Like, what is going on? And so estrogen is like the lubrication to our blood vessels. It keeps everything well functioning and oiled. But when a woman goes through menopause, when her ovarian function ceases, and the main form of estrogen that our body produces, which is called estradiol, decreases very substantially and rapidly, the oily function of our blood vessels now become affected. And so there's stiffening of the arteries, and we have an accelerated risk of developing heart disease, high cholesterol, high blood pressure, and diabetes. And so estrogen actually protects our heart and our blood vessels. And when we go through menopause, it actually accelerates in such a way that it speeds up to the average male as well.
Wow. So when you talk about like how rapidly this can happen, are we talking months here?
Perimenopause is a transition from anywhere from 4 to 7 years. So it's not insidious. And oftentimes, women do not even seek the care of a healthcare provider for that time frame. So when and how the changes in their levels occur in terms of their lipid profiles or their blood pressure or their diabetes screening. It's very hard to pinpoint exactly where in this transition it occurs because oftentimes these women are not accessing care and they're not being offered some sort of screening parameter to actually compare it to baseline when maybe they're in their 30s or early 40s. So it's hard to say exactly when this occurs, but we do know it is something that is very evidence-based and very scientifically proven. It's really important that women understand what their heart health is. And more importantly, they need to understand what are some of the modifiable and non-modifiable risk factors that increase their risk for heart disease. So for example, family history is important to know. Your genetic background is important to know in terms of your ethnicity. If you have a family history of diabetes, heart disease, hyperlipidemia, these are non-modifiable risk factors, whereas some of the more modifiable risk factors would be, your dietary consumption, whether you smoke, your alcohol consumption, the level of stress in your life, even the amount and quality of the sleep that you have, and also the amount of activity and exercise that you are performing on a regular basis.
Wow. So there's like a lot of things that we can do to actually help ourselves, it sounds like. So how, I'm not afraid to admit, I think I'm coming close to this time. So this is kind of a personal question too. What can I be looking for? I do visit the doctor regularly, but is there signs or symptoms that I could watch for that, you know, are telling me that, hey, you need to do something, you need to get this looked at?
So I love that question because I know that a lot of women correlate hot flushes to the perimenopause and menopause transition. And it can be a very distressing
Mhm.
event for women, especially if they're working outside the home and they have important job roles where they're trying to function. And if they're having hot flushes at work and night sweats at night and they're not sleeping well, it can definitely affect their cognitive function, their brain fog. And it sort of has this perpetual ongoing, worrisome, distressing symptoms for women. But there's actually really good evidence that having hot flushes is a biomarker of cardiovascular disease. So a woman who has really severe hot flushes and prolonged number of years of vasomotor symptoms, which the average age is around 7.5 years of symptoms. But if you are somebody who's very, very symptomatic, it actually can be a biomarker of heart disease. So women do need to be aware that hot flushes are something that you just should not ignore. We have very effective therapy, but that it may actually be a signal for some bigger issues as well. In terms of other risk factors or things that you want to be looking for, not all women present the same in terms of, potential risk of heart attack. So sometimes it can be neck pain, sometimes it can be shoulder pain, sometimes it can be even just arm pain. So if you're ever not sure about whether or not your symptoms are or not related to your heart, you may want to consider seeing your family doctor and having a discussion around this so that you are aware and also be aware of what your underlying risk factors are. Because if you don't know, it's more difficult for you to be able to determine if this potentially could be related to your heart.
Wow. So I know there's a lot of controversy about hormone replacement therapy and its impact on our hearts. And for example, my mom refused to take anything, so she suffered for many years with going through the hot flashes and things. So what is the actual truth about hormone replacement therapy and its impact on our cardiovascular health and long-term health in general?
That's a great question, Dawn. And so just to give you some terminology clarification, so when we actually talk about hormone replacement therapy,
Mhm.
that is specifically indicated for women who have gone into menopause early, under the age of 45. When women are using menopausal hormone therapy, so that's hormone therapy for the average age woman who's using it for symptomatic treatment, it's actually called menopausal hormone therapy or MHT. Now, when you look at the Canadian guidelines, the North American Menopause Society, which is now called the Menopause Society, or the International Menopause Society guidelines, nowhere in the guidelines do we recommend menopausal hormone therapy specifically for the prevention of cardiovascular disease. We do know that there is benefits of being on hormone therapy for symptomatic women who may be struggling with hot flushes, mood disturbances in the perimenopause, insomnia, amongst many other symptoms, but we don't specifically treat or use hormone therapy for the prevention of heart disease. I think what women need to be aware of is what we have in terms of evidence of what we can do from a lifestyle perspective, which I've already sort of alluded to, in terms of managing some of those non-modifiable risk factors, taking more time to focus on your self-care in terms of dietary choices, in terms of exercise, in terms of sleep, in terms of stress reduction.
Mm. Yeah, I mean, I think those are just things for almost every chronic illness too. So I think it's really important. So you already kind of chatted about what role diet and exercise play in mitigating our risks. Is there any myths that you could talk about with menopause and heart health that you'd just like to debunk the myth?
I know a lot of women are worried about the risk of breast cancer in terms of just general breast cancer risk if they have a family history, or even so in relation to the use of menopausal hormone therapy. And so, what I want to tell women, number one, is that the use of menopausal hormone therapy is a very small factor in terms of breast cancer risk. Having a BMI of 35 and above, or drinking 2 units of alcohol per day has the same equivalent risk in terms of breast cancer risk for a woman. And really, in terms of the risk of breast cancer, the risk is really only 1 to 2 women per 1,000 women after 5 years of use. So that is a low risk. What women do need to be aware of is that the number one risk for death in women is actually cardiovascular disease. It's not breast cancer. And so if women are aware of this, they can make a lot more in terms of lifestyle choices. And I know it sounds easy to say, to make all of these changes. It's one part of the picture. If a woman is symptomatically not managing her menopausal symptoms with the appropriate therapy, whether it is hormone therapy or a non-hormonal therapy, she's not going to have the desire to want to get up and go to the gym. She's not going to be able to make the appropriate choices in terms of her dietary consumption. And so the important thing is that women understand that if they are symptomatic during their menopause, whether it's perimenopause or in menopause, that we have a lot of effective therapies to treat their symptoms. And by treating their symptoms, we're going to allow them to then make better choices in terms of the lifestyle, habits that they need to make to continue to thrive and age powerfully and healthy.
And I just have one last question for you, and then I'll open it up to anything that we might have missed. But sometimes as a woman, you'll go to your family doctor and you'll talk about maybe this is menopause because I'm having these cognitive things. What kind of advice can you give to women about how to approach their family doctors who might not know, like they're not specialists in menopause or perimenopause issues? How can we advocate for ourselves?
I think it's really important that women do advocate for themselves in terms of what they need to be aware of and what resources are available if their family physician may need some guidance about how to care for them and to make an individualized plan for them. So I want to share a few resources with you. The first resource is the Menopause Foundation of Canada. This is a couple of women, Janet Coe and Trish Barbado, who are senior leaders in their personal industries, but they also went and suffered through their own menopause transition. And so they have now created the Menopause Foundation of Canada, which is really an advocacy platform to help break the stigma of what women experience in menopause. Their website has a lot of wonderful resources for patients. You can actually download a symptom tracker to start monitoring your symptoms because as an average woman, how do you know what's perimenopause and how do you know what's thyroid deficiency or iron deficiency? It's really hard for you to know. And so your job is to collect the data, and our job as your healthcare provider is to interpret that and help decide what investigations or tests need to be done to rule things in or rule things out. The other thing they have on their website is a stepwise approach, step 1, step 2, step 3, about how to prepare to meet with your healthcare provider to have a discussion around your menopausal concerns. Another wonderful website is the MQ6, mq6.ca. So this is a menopause quick 6 six questions that you can actually complete yourself. There's a PDF that's downloadable, and it asks simple questions that you may want to review with your family doctor that addresses the most common symptoms of menopause. So some of these questions include any changes in your periods, changes in your mood, changes in your sleep, and also changes in your sexual function, and also any vaginal or genitourinary symptoms. So
Mm.
it's very comprehensive and it can be downloaded, printed, and brought to your family doctor. The other last resource we have is the Canadian Menopause Society, where we have many downloadable pamphlets that address bone health and heart health and many other myths around menopause that would be very useful for you. The Menopause Society, as well as the International Menopause Society, also have specific tools on their websites for patients and women. So there's a lot of resources available online. You just need to know about them to be able to access them.
Yeah, and certainly like knowing where the right places to go is really important sometimes. Is there anything else that you'd want women to know about menopause?
There's a lot of misinformation currently on social media and online about who should or should not be on hormone therapy, whether that's for prevention of aging, whether that's for treatment of symptoms, whether you can take it in perimenopause or menopause, and what may be some of the contraindications. The Menopause Society recently came out with a statement about the misinformation about hormone therapy, which is a free download, and it really helps to direct women to evidence-based information about who or who should not be using hormone therapy. There is also a white paper that was recently published from the International Menopause Society that reviews the 5 Ws of hormone therapy. So who, what, why, when, and where. And it's very simple to read and very accessible to both healthcare providers and patients. And so I think what I want to allude for women is that going through menopause and entering menopause is an opportunity for you to reassess your own health, your own healthcare goals, and to decide with your healthcare provider with shared decision making about what might be the right choices for you in terms of treating symptoms and also what you can do from a lifestyle standpoint to improve your quality of life and your well-being as you proceed through menopause and beyond.
Awesome. Thank you so much for sharing all of this invaluable information. It's just absolutely amazing how much is out there and the resources. So yeah, just thank you so much again, and we really appreciate your time and your input.